Welcome back to the South Carolina 7th Congressional District Republican primary debate, sponsored by the Myrtle Beach Area Chamber of Commerce and the Grand Strand Business Alliance. In this segment, we'll discuss health care. Candidates will give you 1 minute to respond. If you can do it shorter, we'll get more people in. As I said at the beginning, not all questions would be addressed to all candidates, and we were trying to mix up and get a variety here. So, Tim.
This question came from a News Channel 15 viewer. This year in South Carolina, close to 10,000 people will be diagnosed with cancer, many who are unable to afford treatment. As an advocate, the person who wrote the question in, for the American Cancer Society, our organization would like to know, if the Affordable Care Act is repealed, how would you make insurance coverage available and affordable for people who get sick or have pre-existing conditions like cancer? This is for Jay Jordan.
Thank you. First, we have to recognize that we do have a problem with our healthcare system as it stands today. The issue is Obamacare is absolutely the wrong way to go about fixing it. What you're going to see is what it intends to accomplish is to have more people under health care, and what you're going to do is it's going to have the exact opposite effect. It's going to have less people with health care and more people without jobs, and people without jobs don't usually have health care either. So that's the wrong way to do it. And Congress, Republicans at least up in Congress, are trying to do some things. A few members at least themselves are trying to do some of those things. We're going to have to lower the cost. The way we lower the cost and begin that process is we tear down state lines for insurance companies so they can compete. So people have more choices, and that lowers costs. The second thing we have to do is we have to be easier on our doctors. Doctors do better when they have more time with their patients. I spoke with a doctor the other day in Hartsville. He spends 27 minutes out of every hour when it's a government patient dealing with paperwork. We've got to let doctors spend more time with patients and less time with paperwork so they can drive down costs. Those are some things we can actually do to have an effect.
Andre Bauer.
I was actually the only candidate that actually went to Washington when Obamacare was being held by the United States Supreme Court. I went up there and fought and was a voice and tried to be vocal about stopping it. I can tell you we're going to have tort reform. There should be a copay for anybody that walks in an ER, a few dollars, so you discourage people that are abusing the system. Look, you and I, we pay for it. Other people go in there as a primary care physician because they don't. They have no skin in the game. It doesn't deter them to walk into the most expensive health care there is. We've got to get them into a primary care physician. We need more competition. We need to be able to buy across state lines. We've got to deter making it so that doctors have to always cover their tail in everything they do. We have got a system now where more and more people are looking to win the lottery when they walk in a doctor's office.
Tom Rice. Tom Rice.
I think we've got a wonderful health care system in this country, and I am scared to death of the thought of the government tinkering with it. It seems the government can't run many things as well as private enterprise can. Increased competition among medical care providers and insurance companies, let them compete across state lines, as he said. Tort reform, let's get the doctors out of practicing defensive medicine. Had an interesting conversation with Bruce Bailey, a friend of mine, CEO of Georgetown County Hospital System. He said, you know, the way to fix this is if we can figure out a way to compensate physicians for keeping people well rather than just treating them when they're sick. Absolutely. So we're going to have some innovative ideas if we're going to fix this problem, because it is a massive problem. Again, just the entitlement plans, Social Security, Medicare, Medicaid, welfare, all these things, $1.9 trillion, interest, $300 billion, you've got a deficit right there before you fund any other federal department, including the Treasury, including the Department of Defense. We cannot fix a deficit unless we fix this problem.
Thank you.
We're going to get a chance.
Chad Prosser.
Well, first of all, we need to repeal Obamacare. It's a bill that has done nothing to address affordability of health care, and it has raised rates for insurance. It has not made insurance more affordable. Even parts that have been implemented, like the pre-existing conditions for children, that exclusion has nearly doubled family coverage and coverage for children. I see it in my own business with my employees who can no longer afford coverage for their children. We need to approach it from two angles. First of all, from the supplier side, we need to provide incentives for medical professionals to manage to outcomes instead of being based on their compensation being based purely on procedures. And from the patient standpoint, we need to allow free market competition so that patients are able to make informed decisions, economic decisions about the health care that they're providing, and they're able to make those decisions in conjunction with their physician, with their health care provider, and not be told by the federal government what to do. Obamacare will put 17 million people onto Medicaid and take 3 million off of private insurance.
Thank you.
Another healthcare question. If you look across this district, you have areas where more than a quarter of children and half of adults have health coverage through Medicaid. Many of you have said you want to roll back the president's health care plan, but then again, Medicaid is widely viewed as unsustainable. I want to ask what you would put in place to make sure the people of this district have access to health care. And I want to start with Ms. Jenrette, please.
Well, there's far too many regulations in place to allow that to happen. Medicaid is between Medicaid and Medicare is 22% of our national budget. And people are going to need somewhere to go to have care. However, the FDA needs to be reformed. Pharmaceutical firms need to pony up. Medicaid, Medicare needs a rehaul because there's money there. It's just being squandered and abused and wasted. I had a friend who called me. She's on Medicare. She called me and said she had to get a respiratory something or rather for her cold, and they gave her some $250 apparatus that had nothing to do with just treating her cold. And when she called the Medicare hotline, fraud hotline, they absolutely disregarded her. So that $3,000 a year to rent a wheelchair when you can buy one.
Time.
It's ridiculous. It needs to be overhauled.
Thank you.
Mr. Wallace.
I think federal Medicaid, we need to block grant the money that goes to the states so they can deal with the Medicaid problem, the issue that they're dealing with. But I'd like to answer this question about health care. We were talking about a minute ago. The Republicans had a plan in Congress called Associated Health Plans. That would have provided thousands of mom and pop workers in restaurant businesses, beachwear businesses, businesses all across the country that would have then had access to health care, and it was a great plan as opposed to what the Obama folks were trying to do last year. That's something we can implement right now if this comes out and put people and give people affordable access to health care, get premiums down, along with providing competition across the board with different health insurance companies and getting the lawyers out of it and stopping all these frivolous lawsuits with tort reform. And people would have access to health care, and we wouldn't have to socialize 1/7 of the economy at all.
Now you can pay no attention to the red light because it won't turn off. Please.
And Ms. Culler.
I'm going to tell you what's wrong with our government, and it's our media, because we have the same opportunity to be up here speaking to you as what they consider the top 4 runners. Let me tell you how these polls work. They want to call over 600 people, 35% are undecided, and they're going to allow 400 people to decide who the top runners are for over 700,000 people in this district. That's a bunch of bull. And until the people get up and they stand up and they face the media and they face the people that say we're the front runners, you're never going to have a voice in Congress, the government, or anywhere else.
We're out of time for this segment. We'll be back.